So we're here with Sicco Popma, the founder and CEO of BiO, and we've had the great opportunity to sit with Sicco and learn a little bit about his background and about what's happening at BiO. So Sicco, let's start right there. Tell us, you began your education and grew up in the Netherlands, yes?
Yeah, that's right. So I did my education in University of Groningen, which is not easy to pronounce, but once you finish all your coursework, you can actually go anywhere in the world to do your PhD study and finish out and write your thesis. And that brought me to the University of Pennsylvania.
And so in our conversation, we talked a lot about what you're doing at BiO that makes you different, and in particular, differing from the individual therapies that are being actively developed right now, and in one place at the University of Pennsylvania. So tell us a little bit about the processes and the work that you're doing at BiO.
Yeah, so I worked in this space for, well, since 2001-ish, and I worked actually in a program within J&J on Johnson & Johnson, that is, on an ocular product, which was an off-the-shelf product. So that meaning you prepare a lot of doses from one healthy donor and distribute that to many patients that need it whenever they need it. So it's quite different from the model where we take patient cells, modify them ex vivo, and then after a few weeks reinfuse them, like most famously done right now with the CAR T-cell therapies. So the process that we started out are looking at BiO is that it's very, very cumbersome to make these therapies viable and commercially viable mostly. And that is because the off-the-shelf therapies need individual therapy or individual treatment. So it's more a process than a product. And I thought for pharma to be more interested in this is make it a distribution model. So again, where you have many products off the shelf, ready to go. The only challenge is that for every new car, you would have to build your whole supply chain, your whole manufacturing chain again. So for that caveat, I was working and thinking about, and actually came up with a solution to make what we call a plug and play system. So it's a system that is all fixed. So once you have your universal cell, as we call them, it can serve for all your therapies down the line. So the only variable in our system is the CAR, or actually multiple CARs. So the idea is that you have a killer cell, whether that's a T cell, whether it's an NK cell, you put our gems in it, as we call them. That makes any cell now a plug and play. And within a few weeks, you can have a new clinical entity, basically, by just switching their CAR out and propagate that and put that through your pipeline for development, and you can validate that. So that's in a nutshell the technology we offer. And this is not only for cell therapies or ATMP therapies, we can also do this for CHO cells for the antibody manufacturing purposes.
Sicco, I want to circle back to something you said and just underscore it, and I'd like you to talk more about it. You said to us that you can develop a full-blown cell line in as little as 2 weeks.
Correct. Well, the initial clone. So once you start your initial product that you have, right, your initial cell line, it has the gems in there. Now we can just we don't even use viral systems. We use CRISPR to get the element, the gene of interest that you want in there. You electroporate that, which is a few seconds process, and then you just wait a week or two and select the proper clones with the right insertions, and you can expand those, and you can do whatever you want to do with that in your preclinical development program.
Now, what we found really exciting in this conversation was both the volumes and the cost at which you can deliver. It was just almost stunning to us. Can you say more about that?
Yeah, so the product, especially, and that's what the secret is behind the off-the-shelf product, is that these cells, once they're propagated, it's not linear, right? So it's not twice the amount of cells, that's twice the cost. It's actually the contrary. So the more cells you can create, the less the cost per cell or per dose will be. So the dose per donor ratio is actually going to be the interesting factor. So how many doses you can generate from one donor, the more doses you can generate from one donor, the better the cost profile is. And it can go really low. And as I mentioned to you before, we're kind of restricted by the fill finish in the processes these days, because that fill finish process defines the size of a batch. Growing off the cells probably is not limited, as the tanks that we can use are huge. So it's really the fill finish. So as soon as that capacity opens up, then that bottleneck opens up, the cost can come down even more.
And so the other thing that's fascinating about our discussion, and really what you were introduced to in your J&J days, is what's going to be meaningful to pharma and the actual delivery system. So we talked a little bit about both the end user and the supply chain of this, and I'd like to revisit that as well, because I think that's really a fascinating component about your whole angle and what IO BiO is really all about.
Yeah, so when we have our product, we will, you have different distribution models, right? You can have it shipped on command. Right now, it's pretty cumbersome to ship these massive liquid nitrogen preservative shippers. A lot of companies are actually working on that to make that package smaller and smaller and more convenient. But there's a lot of redundancy required. So do you do one shipment or two shipments independently to ensure arrival? And then maybe later on, and that's more for the individual therapies, but once we have an off-the-shelf product, again, you can then develop a cold chain, have local storage deposits where local hospitals can draw from, or you can have even storage systems at the hospitals. The biggest risk there is the chain of custody, right? So you have to be able to account for every vial that you're going to thaw and inject into the patient. You know, you don't want to have somebody to open the vial, look in it, and close it again, right? So that's something you have to be able to track, and that's really not an easy feat. With our project in J&J, we actually had to go out and train the pharmacy personnel on how to handle our product.
So Sicco, let's shift direction for a quick second and talk about revenue and investment. Mm-hmm. Where are you in that cycle, and what lies ahead? What you're working on is so exciting. How are things coming together in that regard?
Yeah, so we're super excited, and we continue to make progress, and so far since 2018 we have raised about $2.3 million, so which is a very nice amount to work with. And with that, we achieved our proof of concept, and we're now at that inflection point where we want to show our commercial value. So we're looking for a Series A raise. And while we're looking at that, we also do a smaller raise, which we call a bridge note, which is a debt note for $750,000 to get us to the next point in half a year to 9 months. And then our Series A is a $10 million raise before March next year.
And once the Series A raise is completed, what are the next steps for the company? What will you be rolling out? What will those funds enable you to do next?
The first part we're going to do is work on the CHO cells. So we think we can add significant benefits, as the CHO cell will also eliminate the clonal selection and viral transfections. So we have a real edge when we go in the stable cell line manufacturing. Again, we can reduce that time that there's about 6 months and a few $100,000 back to 2 weeks or so to have a stable cell line that is ready for research cell banking. So we can again save a lot of time there, and especially for the bispecific and trispecific antibody market, we think we have a real advantage. So the first funding will go to expand that. We need some quality control people. We need people to have the QC, QA capabilities, and then deliver these products to the customers. And the idea is from the proceeds and also from the investment to then expand to the cell line part. So to deliver a service to make customer cell lines plug and play with our GEMS system. So that's really the near future. And then long term, we also have a source from my co-founder, Utah Lee. He has this very special stem cell source that we're trying to make into NK cells. So then we would be able to provide our own NK cell line for CAR therapies down the line. But that's really more like a 3-year project from now.
Sicco, we're incredibly excited about what you have going on and what lies ahead in the future. We were going to be checking back with you soon, and we really appreciate your taking time with us this afternoon to tell us all about IO-BiO. Congratulations. Thank you.
Thank you, Joe. And maybe we'll see each other back in a year or so.
I look forward to that. Yeah, you bet.
Thank you. Take care.
Okay.